This is a CBS 4 News special report.
Let's go to our state's capital now, where Florida Governor Ron DeSantis has an update on the latest COVID-19 efforts. Let's listen in.
Obviously, when we were going into March, these tests were few and far between. A lot of them having to be sent to Atlanta, the CDC. We've made an effort to really expand the testing, and you've seen that happen over the last 3 weeks, which we really appreciate and are glad. Here's the case trends in Florida over the last 30 days. This kind of tracks, I think, as you started testing more, you started seeing more cases at the same time. You do look at kind of that April 2nd, 3rd was certainly, 2 days of a lot of cases. We've seen kind of a down/plateau, a little bit of a trend there. I think you'll see that's been probably now reflected a little bit in the hospitalizations of what people are seeing on the ground, but that's what we're looking like over the last 30 days. Probably tracks with what you're seeing in some other states as well. Hospitalizations. By age, Florida, we have a majority of our hospitalizations have been folks who are age 65 or higher, and even we've had a number that have been over 85 years of age. Now, obviously, if you're in that 55 to 64, there have been some hospitalizations there, and even 45 to 54. But once you hit that 65, that really increases your risk of being hospitalized due to COVID-19, and that's something that we've stressed from the beginning with people who are 65 and older, and particularly those that have an underlying medical condition. And I think what you'll find is those folks under 65 who are hospitalized, you'll see a lot of underlying medical conditions in that population as well. Here's the hospitalization rate per 100,000 of the population. So again, likelihood of being hospitalized for this much higher the older you get. Obviously, of course, very low for folks who are in their younger years. This is when we were starting all this. With coronavirus, when it really started to get hot and heavy, with the 15 days to stop the spread, some of the measures that we took in the state of Florida, other states took other measures as well. The main reason was to slow the spread so that the hospital system would be able to cope with people needing to be hospitalized due to being infected. And the idea was if you just did nothing, the infections would spike, it would overwhelm the hospital system, and then obviously that would be bad for COVID patients because there wouldn't be enough, but then even normal patients for other things wouldn't have the hospital resources, and so you're talking about hugely negative health outcomes if that were to happen. And so what we've been doing in Florida is making sure that the hospital system can cope with the COVID-19 patients. And I think what you'll see is if you look at March 20th, there were a little under 15,000 Class 1 beds available throughout the state of Florida. Now there's almost 22,000 beds throughout the state of Florida. So even in some of the areas in Southeast Florida that have the majority of our cases, actually about 60% in the 3 Southeast Florida counties, most of those hospital systems have between 40 and 45% of their beds available. So in terms of this maxing capacity, I think we've not seen that here because I think a lot of things were done, to ensure that we'd be in good shape. Same thing with I think the story is the same with the ICU bed availability. Prior to really having the COVID, outbreak where a lot of people were being hospitalized nationwide, Florida had 1,665 ICU beds available statewide. Now we're about 2,500 statewide. So you've seen, a pretty big increase over the last period while we're dealing with COVID. And again, that's because you're trying to flatten the curve, doing things like stopping the non-elective surgeries, which we did to make sure that we had enough hospital space and could cope with the infections. Here's just a little bit of a comparison for what some of the other states are dealing with. Obviously, New York has been hit very hard. So cumulative hospitalizations per 100,000. So this is from the beginning of COVID until the present. Florida's had 14.9 per 100,000. Obviously, New York, you're looking at almost 240, but then Maryland, Massachusetts, Georgia, Ohio in that. And then the ICU of who are currently there, you look at Florida per 100,000. We got about 3.8 Floridians in the ICU. Of course, New York, New Jersey, Michigan, Illinois, we're pretty similar to where California is in terms of the ICU. So. And I've been talking with different folks at various hospitals. I think that if you go back a month ago, most of them were understood we had a mission and they were good, but there were some whose, hair were on fire. The world was, they were really worried about what was going to happen. I think now people feel like the trend has been good, and I think really across the state, I think they're confident that they're going to be able to handle the COVID patients. Of course, you watch it every day to see how this is going. But in terms of flattening the curve and in terms of making sure you have hospital utilization available, clearly we have not gone even close to busting the medical system here. In fact, I think Florida sees it and other places around the country is because there's been so much space created, I think you're starting to see some people get laid off on the other end of this, and so you may see some hospital resources diminish. I think we can mitigate that and not let that happen here in Florida, but you are seeing that throughout the country. So flatten the curve, all about the medical system. That was the number one reason to do it. The people that were kind of in this field, when you flatten the curve, they actually project the same infections to happen. It's just they're more spread out so the medical system can deal with it. So that's what I think has been something that we've been monitoring probably more than any other thing. I mean, we know there's some people that get COVID-19, don't even know they have it. Some people are asymptomatic. Some people have very mild symptoms. But what about those folks who are going into the hospitals? I mean, that's something that's really, really important. So I think the message is just let's just keep doing what we're doing. But I think the trends in this respect have been very positive. Now that we are seeing these trends, we obviously got to be thinking about what the next steps are for the state of Florida. I know the president has been talking about, the quote, reopening of the country. Some other governors in the Northeast, out west, have talked about what kind of the next phase of this looks like. And we still don't know everything about this coronavirus, and we obviously watch the data on an hourly basis, even a minute-by-minute basis, but it obviously is prudent to start thinking about and planning for people getting back to work and getting society functioning in a more healthy way. So I am going to be putting together a task force for the resurgence and reopening of Florida. We'll release all the names. We're getting everybody on board today. Hopefully I'll have those names out to everybody by the end of the week. But what I want to do is tap into people in elected office, people in business, people who are involved in education and all kinds of things, and get the best ideas about what's the most prudent way to move forward. So I'll be seeking advice and ideas on pretty much everything under the sun: small business, agriculture, restaurants, tourism, large events and conventions, recreation, international travel, K through 12, as well as higher education. There are a whole host of things that we need to be thinking about. We're also specifically looking at, and I mentioned this I think yesterday, the day before, testing. Now, we've done a lot on testing, but I think with the new technology that's available, I think a lot of employers are going to want to have easy access to tests that can be done quickly. Hopefully you get the instant test, but if not, at least be able to get one within 24 hours. And so I've got folks working on that. What does that look like? What type of resources can we leverage to do it? I think it's just been a capacity issue in terms of Abbott is producing 50,000 of these cartridges a day to go out, but we've got a big country. We've got 330 million people.
Okay, you've been listening to Governor Ron DeSantis in Tallahassee there, giving an update on COVID-19. You can continue to watch this press conference on our website, cbsmiami.com. He's talking about the preparedness of the state, saying that the system has not been overwhelmed in Florida.